Government stands firmly in support of the motion. This House would give social service and skill training for gambling offenders rather than imprisonment. Because gambling-related crime is not born primarily out of malicious intent but out of addiction, impaired control, and socioeconomic vulnerability, problems that prisons do not solve. The World Health Organization is unambiguous. Gambling is a major public health challenge. World Health Organization data show that 11.9% of men and 5.5% of women worldwide experience gambling-related harm. And individuals with gambling disorders are up to 15 times more likely to die by suicide. While in places like Victoria, Australia, 4.2% of all suicides were linked directly to gambling. Even more alarming, for every single high-risk gambler, six other people are harmed, usually family, partners, or friends. This means that gambling harms multiply outward and devastate whole communities. To treat such a problem with prison, an institution built for containment, not care, is both ineffective and unjust. Instead, offenders must be met with structured social services and skill training that address the actual drivers of their behaviors. Research published in Forensic Population and Problem Gambling finds that around 1 until third of offenders meet the criteria for problem or pathological gambling, and another study of Canadian federal offenders found that those with gambling severity were over 4 times more likely to reoffend than their peers, even when controlling for other risk factors like substance misuse. These figures prove that without intervention, the cycle of gambling and crime feeds itself. Debt leads to crime. Prison compounds poverty, and release leads straight back to gambling. Evidence-based therapies break this cycle. Cognitive behavioral therapy, motivational interviewing, financial management training, relapse prevention, and activity scheduling have shown consistent results in reducing gambling harm. Even innovative internet-based CBT programs just for justice system clients are already proving feasible and effective at scale, making treatment accessible to offenders who may otherwise avoid in-person service due to stigma or logistical barriers. This is not mere speculation, it is evidence of a treatment pathway that works, where imprisonment demonstrably does not. International norms also support our policy. The United Nations Standard Minimum Rules for Non-Custodial Measures, known as the Tokyo Rules, together with UNODC guidance, explicitly call for proportionate, rehabilitative, and non-custodial sanctions for non-violent offenders. They stress reintegration, rehabilitation, and reduction of prison overcrowding. Our model combines exactly. Offenders are held accountable through mandatory community service, monitor counseling, and vocational training that restore economic stability while ensuring supervision and restitution to society. Let us now anticipate and rebut opposition claims. First, on deterrence, they will argue that prison deters crime, but addiction is not rational. World Health Organization classifies gambling disorder as a behavioral addiction precisely because it overrides rational decision making. You cannot scare an addict into recovery, but you can treat the psychological and socioeconomic roots that cause relapse. In fact, studies of correctional population confirm that punishment without treatment fails to reduce recidivism recidivism, whereas programs that provide counseling and skills training dramatically lower offense rates. Second, on public safety, the opposition may suggest that letting offenders remain in the community threatens society, but the Tokyo rules themselves make clear that non-custodial sanctions come with strict conditions: mandatory reporting, regular monitoring, structured service hours, state sanctions for non-compliance, ensuring accountability while still delivering therapy. This model is actually safer long term because it prevents relapse into gambling related crimes. Third, they may say that rehabilitation is lenient, yet World Health Organization reminds us that harms extend to families, children, and creditors.